re tla simolla ka mokhuduthamaga wa rona wa lefapha la pholo go tla gore ragela bolo re kicka TV halala kick TV halala halala kick TV halala yeah halala Tshing halala halala MEC halala yeah MEC uta o bala message pele yeah re mahoko na ya mokhuduthamaga message yes
Any message.
halala MEC halala are moretseng.
Okay, thank you very much and good morning. How are you? Cover your cough to prevent the spread of TB.
Halala MEC halala ra itse ha e korarare Kick TV Ariang rare Kick TV yes re tlanela MEC Vessels Moreng go tswa ko Community Safety and Transport Management are mo pela ndiata yes Transport Safety Community Safety and Transport Management yeah MEC o tla re balela we kick TB re dira dilo tsa nnete mo bokoni bophirima MEC
HIV, get tested, get treated.
halala MEC halala
Halala,
yeah MEC Kick TV rara
Kick TV.
yes we korile
Yeah. Kopa
mo primary and Tate Lazarus Kagisho mo khosi ke na ta ragelang re bone gore yeah
Cover your cough to prevent the spread of TB.
ra leboga amafofi yeah ya no renela premier premier why banka why position halala premier halala Kick TV ra leboga my selector ra leboga
Selector.
yes Renali the last key chairperson ene
Batho ba tshotse dipale, busang dipale tseo, match
tisandi pale le tlogatse chairperson
Match ga o sufele.
PCA re semi
Match ga o
busa
sufele.
dipale semi MEC le ene ga isa rage ba go tlogela yang ko morago
Match ga o sufele.
match a so fail wa itse di tsa bo Chiefs le bo Pirates tsene la bo hetsa match o so heal
Ela Chiefs jwa ba re match o fedile. Match ga o sufele.
yeah re na le bakhuduthamaga ba bantsinyana ke letsatsi la TB gompieno we are celebrating it at the Northwest Province ke mokhuduthamaga wa Public Works yeah mokhuduthamaga over to you.
Cover your cough to prevent the spread of TB.
Marikete di MEC le bala message o wa nehela ipitukul scanner message yeah good utlo yeah
Coughing,
yes
night sweats,
yes
loss of weight,
yes
fever.
yes
If you have those, get tested for TB.
halala TV halala ay MEC ya no yeah MEC Kick TV ra leboga MEC ke tshepa ba feletse modlo a ba feletse ha ba feletse re ntsheng dipale my selector ba feletse
Kone motshameko o ile bokhutlong re tla nela jaanong mo tirong official. Rona re kopa re nne mfatshe ba gaetsho le re etseng ka kelo tlhoko le ka tlhoafalo. Melaetsa e ditlong go ihiwa ke boeteledipele wa gompieno.
Okay, Rasimola, mañana. Arisimuleng kwa panare. Arisimuleng DJ Ngaiba haitu. Rito simula na gori fili. Executive Mayor Majoro. Rito pesa kaba ati. Kani mukoni. Ifa Majoro space. Majoro la. Rito simula our main World TB Day program. Lina la meke selo le hari MEC wa Health. We are two program directors. Selo la hari le Miss Kineile Ramoy. Uga Ramoy. Miss Barawena. O kitamagelo one. Okay. Renale le ka khona ho DJ o ka khona ho opela national anthem e na ready mo. Now mo program mo ne ke bona faith based sector bagay. Faith bagay. Nagam. Faith based sector abate e ba seteng re tswela pele ba ba emeng ka maoto go morago go na le ditilo mo le ka tla mo ba haetsela tsona fatshe mo ba le emeng ka maoto le ka tsena ra nna fatshe mo bontate a re ne mo ditilong ka kopo tlhompho le lerato. There are a lot of chairs here. Look at Nafat. Retlokupa DJ Remengama Utu Rotoboleni Huse Bondate Ribule Tiroloya Humpienu World TB Day Kapinarna Abosichava Unne Batuba Bana tshwanetse ba rapello ma ke ba bone mo ke lena ba faith based or ke lona ke bona le ntse re le kana mena so re ga maka maoto ba heso re ga maka maoto. Thank you very much bontate ba tlhobola di hutse di kuane ra ema attention Rabula kapina ya bosetšhaba. Over to you. Thank you very much, Ralabo. Rewile Tata. Ntelo Sinyanago. Rena Barile, ready program director. Rena di program director Niti. We don't waste time. The next item, Kikamohelo, cause the welcome remarks, got the acting mayor of JB Max, executive mayor, Honorable Leon Mkabela Humpienu, Kena Majoro Satswerewa JB Max, Kaskuawarki acting executive mayor of JB Max. Kena Dotla Mopelemo, Arirela, welcome. Majoro, over to you. Amuhela Batuba, Batilemo, JB Max, Mo Fenzers.
Halala JB Max, halala. Halala JB Max, halala. Halala Tshing, halala. No, Aki level head to the MEC of Health, Ndate Lehare. Kili dumedi seba kholo, botle ba Fendersdorp ka kakaretso. Let me take this opportunity to acknowledge the presence of the Honorable Premier of the province, all MECs present here, the MEC of Public Works and Transport, the MEC of COSATMA, all executive mayors present here, the Honorable Member of Parliament, Messine, traditional leaders present, faith-based organizations, members of the community and leaders, stakeholders, esteemed partners in health and development. Ladies and gentlemen, Dumela. Today marks the World Tuberculosis known as the TB Day 2025. And we are gathered to reaffirm our commitment to ending TB. This year's theme, yes, we can end TB. Commit, invest, and deliver. Remind us that stopping TB is achievable if we can work together. Despite progress in preventing and treatment, TB remains a significant public health challenge, especially in low and middle income communities. Our province, particularly the Dr. Kenneth Kaunda district, is heavily affected with one of the highest TB prevalence rates in the Northwest province. Today we honor individuals like Comrade Sandra Mudise, who courageously shared her TB and HIV status, helping to raise awareness and promote a supportive community. Today, our goal is to make TB service accessible to every household, workplace, communities. We must improve policy execution and early detection and treatment access. I urge you all to engage actively in today's discussion and initiative. Let's work together to strategically and optimize resources. Once more, Welcome to JB Marks Municipality, where we are committed to our community's welfare through knowledge sharing, proactive measures, and dedication service. Let's reaffirm our dedication to ending TB and invest in a healthier future for all. Further, yes, we can end TB. Thank you.
Leboile Majorum Kabela Armufe Mazo Hape. Mema Zapola, Agizur, Mema Zapola Hosa Me Grace. Elega prepara who acknowledge by Mbaro Namu. Or Bahiva JB Max Fendersdop. Bakono Wizuri, Kiwomamba Walindemu. Raudwanagar. Okay, Me Grace. Agaira Efawena, Rashara platform. Me Grace Taylor from health. Udem. Ask them get change. I think. I will not prepare a fair, I'll go miss after 10 minutes. Or Murutinel, Umawon. All ready list ya the guest. After 10 minutes, get don't miss a mopilimo. I do resistable. So go simulo and get a lucy story. Again, no sick is a male. We're not remus. Okay. I get more program in Mary Mrs. So I go back to Baisa. Give Mr. Tembulen Tengum. More program in mobile repos of Anwalam and again that. Mr. Tembulen Tengu, over to you.
Dumelang bagaetsho. Dumelang bagaetsho. Leboga. O mo mfa ke Thembile Ntengo. Ke modula stilo wa private sector forum under the provincial AIDS council. I'm chairing the provincial AIDS council le the honorable premier. Bagaetsho ya ka MEC asase a tlhalositse ke tlo tsamaisa tiro ya gompieno le ene mo itemeng e latelang re tlo kopa feedback ya door to door if sampe ile teng ga feedback ya door to door ile siko ke tla gatela ko pele ke kope message of support for TB and HIV mo Mr. Pule Mongali, our TB survivor. O teng MEC gompieno ka re batho ga bayo okay wa tumela my selector se kinya solanka tumela ska tla ka situ ba gaitso motho ke TB survivor ya rona go pa re mo shapele matsogo ba gaitso a re meletse matsogo this is our survivor go pa re mo shapele matsogo. Mabel, bagaetsho today we celebrate the World TB Day. Ntate Mongale ke survivor ya TB. Ke go pa re fe ntate Mongale attention. Are tlogoleng go bua, re itsele mo ntate Mongale bagaetsho. As a belief, go pa le mo fe tlhompo e a deservang, as a belief to.
A ke tlo bua ka sekgowa ka gore sekgowa ke se itse. Ke tlo bua ka Setswana go bana Setswana ke se itse. Ke ne ke lo go
ko XRD TB ko Tshepo ke ile for 4 months and mo 4 months nyane yo ke ile ka 2022 ke buile ka 2023 so gora gore ke survive ba go ke ile go loko ke ne ke struggle ka gore maoto aka a ile a fasa mara ka go dumela gore TB ya fola ke now ke fodile so le lena ha lena le tshepile ntate modimo le tlo fola mo TB mara o itse gore TB e tsamisana le HIV ha o na le TB o na le HIV o itse gore di tsamaya mmogo di tsamaya mmogo TB le HIV fela di batla gore o nwe pilisi ke nna o ke nole ke shapa ke alright ke hela yana ke number 1 bagolo ke number 1 ka go tshepa seo ngaka infant sone ke ne ke sa di hitli mo tla ga di bete mo tla ga mesamo ke ne ke lwa spilisi le no yana sanle ke e lwa pilisi o bona ke tla khutla ka marara ka dina la rara la moralla mo ya wa halelela
Ara ha o batla go fola se thapelo fela o nwe dipilisi tsa gago ka ntle ga go senya nako re tla ya ko message of support so from South African local government from ntate Khumalo Molefe e seng khotso Khumalo Molefe dato Khumalo Molefe ka re ga ayo MEC tla re tlole a re tsamaye ke ya go message of support from civil society mme ke neilwe ke tsapa gore ga yo ise ke mmone ka jeko ke neilwe message of support from civil society forum miss ke neilwe Ramon people living o ko moraga ka mme ke yo fa over to you ra leboga.
Thank you very much. Halala Ventersdorp halala. Halala Tshing halala. Halala Tshing halala. Tshing. Okay. Thank you. Tshing. Tshing. Okay. 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 Galebo. Thank you very much, community. Let me take this opportunity to give you a message of support from the Civil Society Forum. As a PLHIV Sector Deputy Chair in the Northwest Province. Honorable guests, esteemed leaders, healthcare workers, civil society representatives, and my fellow brothers and sisters in the fight against TB and HIV. I stand before you today not just as a representative of people living with HIV, but as a witness to strength, resilience, and courage of those who face both HIV and TB every day. I stand before you as a voice of hope, a voice that refuses to accept that TB continues to steal lives when we have the power to stop it. Today, we gather under the powerful theme. Yes, you and I can end TB. Commit, invest, deliver. This is not just a slogan. It is a call to action, a reminder that the fight against TB is a fight we must win together. Commit. Ending TB starts with us. Ending TB requires a commitment from all of us: government, healthcare workers, civil society, and every person in this community. Commitment means that we will not let stigma, fear, or misinformation prevent people from accessing the care they need. To my brothers and sisters living with HIV, we must commit knowing our TB status and completing our treatment. We must commit to support each other because we know that TB is leading because the death amongst people living with HIV, but it does not have to be this way. To our leaders and policymakers, commitment means prioritizing TB, preventing and treatment, ensuring that no person left behind. To our healthcare workers, commitment means treating every patient with dignity and compassion, making sure that they stay in care and complete treatment. Ending TB, not someone else's responsibility, it is our responsibility. Invest. The cost of an inaction is too high. We cannot win this fight without investing in people, in healthcare system, in new TB prevention strategies, and in ensuring that treatment is accessible for all. We need investment in TB education awareness so that our people know that TB can be cured. We need investment in community healthcare workers so that no one has to travel long distance to access life-saving treatment. We need investment in strengthening TB and HIV integration because when we fight this epidemic together, we save more lives. The cost of inaction is measured in lives lost, but the return on investment is a healthier, stronger generation that will no longer suffer under the weight of preventable diseases. Deliver. It's a time to act. We know that needs to be done. We have the tools, the knowledge, and the medicines to fight TB. Now we must deliver. We must deliver services closer to people. TB should not be diagnosed late. Every clinic, every community health center, every mobile unit must bring TB screening and treatment where it is needed most. We must deliver support to patients. TB should not be diagnosed late. Every clinic, every community health center, every mobile unit must bring TB screening and treatment where it is needed most. We must deliver support to patients so that no one stops treatment because of stigma, lack of food, or transport challenges. We must deliver on the promises that no one will be left behind, not the poor, not the vulnerable, not those people living with HIV, not our brothers and sisters in Tshing, in mining communities, in rural villages, and in informal settlement. Together we can end TB. When HIV and TB fight together against us, we must fight together against them. We are stronger than TB. We have defeated pandemics before, and we will do it again. Today, I ask each you to say these words with me. Yes, we can, and we can end TB. Say it with belief, say it with commitment, say it with action. We will commit, we will invest, we will deliver. And together we will see a future where TB is no longer a killer, but a disease of the past. As PLHIV sector people, we always say, nothing about without us. From the placards here, can someone please hand over the plaques to the Premier so that this must not be a thing of today. It must be always. Thank you.
Repule Mongale wa batliwa ko radio ko ntle for interview. Traditional dance already ya gaetsho re mo pitlaganong ya nako. Already mogolo kwana ba gaetsho mo mogolo kwana.
Okay. Esandre mesi bahaya suba para mo. Rito pa me Grace. Jalala. Erga fula noise bahaya su. Ralo kopela. Erga buela ko tlase. Please patompehi. Dangi. Thank you very much. Rikopa me Grace tele. Erga tomba nako ra emanyana ka o bolela re bolela mo re tlo fetsa ka pela nan ready mo kwata ndato kere nan ready mo be ready litle mo le toro bontsha metlholo ne be ready.
Halala extension 2, halala. Halala O29, halala. Ke a le dumedisa, ke a leboga motsamaisa tiro Honorable MEC for the opportunity. Ba gaetse tiro aka ke nyane fela ya go tla go luitsise gore re na le bomang mo magareng ga rona. Re leboga le go itumelela go nna teng ga mo primere wa rona Honorable Premier Mokhosi o gape e leng modula stilo wa Provincial Council on AIDS. Rena gape le Re Wilson Ntengo o tsamaisang tiro le Honorable MEC who's also a co-chair of PCA representing private sector as a chairperson. Mayor Mildred Maropefela, who's also the deputy chair with Motlotlegi wa rona Honorable Premier ga nna teng gampieno ene le maloko a mangwe a civil society leadership go na le lenaneo le ba le attendileng ko national bana le rona ka moya re lebogela go nna teng ga baeteledipele ba rona members of executive council re na le Honorable MEC Lehare from the Department of Health Renale Honorable MEC Re Vessels Morweng from the Department of Kosatma. Renagapele Honorable MEC Meli Zimukua from the Department of Public Works and Roads. Re mo magareng ga rona re ne re tshwanwa ke go nna le kgosi ya rona, Kgosi Maotwe, who's also the chairperson of the tribal leadership. Re na gape le moeng o motona go tswa ko National Assembly o e leng gape ngwana wa rona, ke motlotlegi mare ke ngwana wa rona, re berekile le ene sebaka, e leng Honorable Maselo Senne o tshwereng di-portfolio tse pedi ko nationally. Northwest ya ntsha, Northwest ya ntsha ke re bagaetso. Ehe, o mo di-portfolio tse pedi, portfolio ya health le portfolio ya minerals and petroleum resources. Re itumella go nna teng ga gagwe. Re na gape le acting executive mayor for Dr. Kenneth Kaunda o lemfa mo boemong ba ga Honorable Nikiwe Nam, e leng Honorable Mpho Matsapola. Re be re nna le makhanselara a rona a tlotlegang. Re na le Honorable Leon Makabela, who's also the acting mayor for JB Max. Re be re nna le MMC for special projects, Honorable Tandiwe Mtai. Re be re nna le Dr. Molawa NEC Sanko. Re be re nna le Chief Whip Honorable Lumkile Links. Re be re nna le MMC for sports mo JB Max, Honorable Patricia Nchali. Re be re nna gape le our ward councillor for Ward 29, Honorable Mokoni Pauline. Re lebogela go nna teng ga all the members of Provincial Council on AIDS, by kesa babalang, our honorable MECs, baba sentemfa, baba rumilweng, ki mo primere, go ya ko ditirong tse dingwe, le bone ra ba acknowledge. Re na le leadership from mining sector, ba teng mo le gang ka se ka ba bitsa ka maina, re lebogela boleng teng ba bone. Re na le heads of department, mafapha a farologaneng. Re na le head of department for health, re o Bakeng Mongale, ra go leboga go nna teng. Le bao ba ke sa ba boneng. Re na le senior managers from different departments, colleagues, you are all acknowledged. Re na le labor, ba teng mo gare ga rona re a le amogela bagaetso, our ward-based outreach teams, re a le amogela all civil society organizations, re lebogela le all developmental partners, ba ba lemfa multi-stakeholders, ba ba lemfa mongwe le mongwe o lemfa today, o moeng wa tlotlego o botlhokwa mo lenaneong le re leng mo go lone ke re sosologang lo amogelesegile. Ke a leboga.
Okay, Ms. Grace, thank you very much. Ki Chief Director wa Health Programs, ko Department ya Health. Re tlo kopa musical item, ala rifa Lina, nna ke tla lefa dina. Oh, Steve Bigo, Community Health Center, Arwa Velo Hofi. No, arle batang. Mo. thusa mo. Golele konoti. Adiegwa. Batla o thusa. Bye. Golele konoti a le thuse mo. Ntshwarele mo. Aditle mo kwa. Mo. Ya. O kone. Ah, it's all this way. Shift and two. Yeah, that's right. Anamu. Steve Biko, over to you. Kandalim Tusila. Okay, Ralabo Hartwala Pele. Rai movies are programmé ya tsamaya yona ra fetsa sekgale mo program ya me ne ke na le message from support from House of Traditional Leadership Khosi Mautwe ke a mo isa ke mone mo unless go na le khosi a mo rometseng team ene prepare event o batla le confirm le batho moruti neo le tloela fela o manya o nyaka le cheke le batho before event or re felletse na ha teng khosi e disturba go o manya ha teng khosi message of support rafeta khosi ha teng from private sector Mr. Wilson Ntengo, Northwest Private Sector Chairperson. Over to you, Mr. Ntengo. Say name is my brother from another country.
Ka leboga bagaetsho, ke a leboga MEC. Honorable guest, community ya rona ya mo Tshing, baeng ba rona, re silwe ke nako. Bagaetsho a ke go bua sekgowa se se ntsi nna vandaga. Ya ka MEC a tlhalositse nna ke modula stilo wa lefapha la private mo Bokone Bophirima. Ebile ke nna co-chair ya Provincial AIDS Council ke chaira le mo primary ka fa. Molaetsa wa tshetlega o ke itlisitseng fa ka jeko ke gore rona ye ka lefapha la private re supporta government le civil society le di community go lwantsha le roborobo lena la HIV le TB ya ka lefapha la private ka gore go mafapeng a private batho ba teng ba wela mo di community ba bereka mara ba wela mo di community le bone a census counter state ya ba balla. So gora gore ya ka lefapha la private tshantse re gatelle di programa tsa rona tsa HIV le TB ke utlwile ba bua ka close the gap 1.1 million gap ya batho ba ileng gore ba batliwa gore ba tlo tsena mo treatmenteng le bone mo TV ya announce last day ka October mare nna ka re batho bao ba ba 1.1 million bao ba re bitsing ka fo holong ka fa le ko ntle le ko magaeng ra itse gore batho bao ba kae bao ha isa batla government mongwe o itse mongwe gore mongwe o go kae ko tlung go gae ke a itse gore ona o itlogetse treatment ntate wa itse re mme o itlogetse treatment so go tswala gap ya 1.1 million e batla personal and individual intervention ha e batle puso ka bonosi e batla le rona ba lefapha la private re gatelle ra gatella re tlo tswala premier gap mo primary ya ka re buile go briefing re itse rona ya ka lefapha la private re tlo tswala gap eo mo primary ke a gola wa bona fanda ga gore go ntle kwale go different today o a bona mafapha private a tlile ka jeko le go tlo supporta community ya rona ke dumela gore o bone mine wa rona mo Dr. Kenneth Kaunda Harmony e teng mo e tlile gore supporta Harmony then ba beletse matsogo ba gaitso re na le gape mafapha a mangwe a private go na le mine o motona wa platinum mo lefatsheng o teng ko ntle kwa le ba re ke Sibanye Still Water re na le di medical aid tsa rona bo Evo bo Bonitas ko ntle kwa le ba teng bo Thebemete bo Sisonke le ba bone ko ntle bo Discovery ke go bontsha tsepamo ya gore rona ya ka lefapha la private re tlile go thusa ra golwana ntwa ena le governmente aka amakalo ke tswalla ka gore #aina bungozi tsa treatment ya gago #checka impilo #close the gap ke a leboga ba gaitso
a re mo fe matsogo re lebohile mo re na le Dr. Molawa le Dr. Khumalo ke maina e be re na le Dr. Despo Mohono ke qualification Eh? Dr. Molawa, Dr. Kumalo, Kimaina, those are names. Emergency Dr. Despo Mohono, give qualifications. Message of support from developmental partners, Mr. Selaelo Rakubu. Okay. Armofelo Ofi before Bua. Mr. Selaelo Rakubu, AFSA Provincial Manager. What like Carlos in full? Agabato Mutela Tiro. Mr. Selaelo Rakubu, over to you.
Ke a leboha Program Director. Ke thome ka go dumedisa Honorable Premier, the MEC tse di leng ona, the HODs, maloko a Provincial Council on AIDS, le Global Fund, CDC, le Developmental Partners, le community ka moka ke re thobela. Rona jwalo ka di developmental partners, re ema le government ya rena o lwantsha bolwetsi ba TB. Re latela le strategy sa World Health Organization se lo reng se re ka 2035 ha re a tshwanela ho ba le bolwetsi ba TB. Ha re a tshwanela ho ba le lo reng wa tlhokofala ka TB. Ha re a tshwanela ho ba le lo re wa lwala ka TB after 2035. Letšatši la today le commemoratiwa ka kgwedi ya human rights. So e bontšha hore TB le yona ke bolwetši bo e le horeng a bo kgetholle motho. A bo nyaka go tseba hore o lekgowa, o Mosotho, or eng, bo tlhasela batho ka moka na bona. So ka mokgwa re everybody wa leng ka mo o na le access to health tse di lekanang. Re sa kgetholle ore o tswa kae or o dula mo kae. Ele ka hopola ka 2019-2020 o kile wa tsena bolwetsi ba coronavirus. Bolwetsi bola bo ile ba tlhakatlhakantšha country ka moka to an extent ya hore economy ya country ne eme. The services tsa Department of Health and other departments ne di eme. Mara because maloko a Provincial Council on AIDS, the developmental partners, le civil society ne re tshwarane ka matsoho ra kgona ho lwantsha bolwetsi bola. Ka mokgwa re kgonne ho lwantsha bolwetsi bola le TB re tlo e fenya. E ka se re fenye TB. The developmental partners re committed o thusha Provincial Council on AIDS, lo thusha Department of Health o lwantshana le bolwetsi ba TB. So only few things jelo re di dira o bontsha hore re supporta Department of Health le PCA. So ke tla mentiona tse few nyana. Engwe re dirang ke research and innovation. So the research charana we focus on HIV, TB and STIs as well. And we advocate for prevention progresses, we for screening, testing, treatment, the IEC materials. We support overlay the monitoring and evaluation or recono province EME mokai, Lord Rejo mokai, Rea mokai. Engwe ke nyaka ngor le tsebe community ko hore developmental partners ona le batho ba ile re ba trainer mo metseng ba ile re ba bitsa di community based organizations batho ba hore ba trainer hore ba gone o le screener lo le refera for TB na go ngwe le re di clinic di gole but ona le batho ba ile re ba testi ba trainilwe ka mahara motse le bona ke tla ba direla boipile jore ba ke bona je community ke kgopela le community hore e berekisane le bona ene le ska ba fa di address tša di wrong ka gore e re se tšere lenyaka re a sokola. So jwale ka developmental partners re rata ho leboha Global Fund le CDC ka ho re thekga kudu ka ele tseba hore o na le mathata a itseng ka USAID e lo ra kenya go tsena mo gona. Re kgopela le ditlhogo tša rena tša di politics or ba re direle plan ya hore o be le other mechanisms tša di funding gore dilo tše ka mokana tšona re kgonne go di gaina ka TB di seke tša boela morago. Halala developmental partners, halala. Ke a leboha.
Matsoho ke se jwale ba apara disutu ka diteki ke se jwale. Now the theme ya rona ke yes we can end TB, commit, invest, deliver, close quote. Yes we can end TB, commit, invest, deliver, close quote. TB symptoms. Rowana bangor ongare TB ya mufitlela. Loss of weight. Ukana itebella mo. Cough. Or tola too much. Now and then. Night sweat. Sitito sabushihu ntate mambo. Ngile ka shara rumulo ena ka bona o sitito bushihu so. Ntate mambo. TB symptoms, loss of weight. Agere usara ki TB. Hases maga agere. Mulwezi boetala mutomo lomu. Wadu mazuguri. Toma wi tlatoba. Fuwa ditlare wi kalafise. Hey usweri, you don't have time to panic. Loss of weight, cough, water, night sweat, husas tito bushiu. We talk about ntate mambo. Message of support from Honorable Marcelo Tshing, Portfolio for Health, Minerals and Petroleum National Assembly. From Cape Town, Mayor Marcelo Tshing, message of support, over to you.
Thank you very much, Program Director, MEC for Health in the Northwest Province, Ndate Muruti Lehari, Executive Mayors present here today, Civil Society, Private Sector Forum Chairperson, Sanko NEC Member Dr. Mulawa, Departmental Officials, Organized Labor present, MECs present today, our Honorable Premier, Baaki ba JB Max, all protocol observed. Dumela mbakaezu. Halala JB Max halala. Halala JB Max halala. Thank you very much, Program Director. Honorable Premier, on this World TB Day, as the National Assembly Portfolio Committee on Health, we stand united with the people of Southern Africa in the relentless fight against TB. The slogan of an injury to one is an injury to all could not be appropriate, for one death due to TB is one too many. We have to rally behind as baagi because TB affects really babohle. we have to rally together because TB is treatable and is also curable. Our game change is teach one, teach all. Let us revive these slogans which ushered South Africa into a democratic state in support of the infected, affected, and impacted, leading to TB-free communities. Honorable MEC, to those bravely facing TB, your courage inspires all of us. To the families, caregivers, healthcare heroes, working tirelessly on the front lines, your dedication lies the path towards TB-free future. The theme, Ubuntu, lives through you. South Africa has shown remarkable resilience in combating TB. However, the journey and the challenges continues. And we must rally together as a collective to fight this TB. Together, we must amplify awareness. We must ensure equitable access to treatment. And we must support innovations to overcome challenges like drug resistance, TB, and HIV co-infection. Honorable MEC and Premier, I'm very happy that the private sector is here. I'm very happy, especially that Harmony Gold Mine is also here. We had an oversight visit as a Mineral and Petroleum Resources Portfolio Committee to Harmony Gold. And the systems that are in place in that mine in terms of TB control and HIV and AIDS are commendable. So keep it up. Let's also commit to get tested or refer those who have TB symptoms, spread the knowledge and advocate for a healthier community. And I also want to commend the department ka program ya King Boiketlo. Tuba King kana. Tsela ka boitekanelo. Yes. As a healthy person myself, an active person, I really encourage the department to make sure that program eo asia ukwala di report ofela, but it's a program elong where it's been practiced in our communities, working together with Department of Arts, Culture, Sports and Recreation. Let's encourage our communities. Let's promote healthy lifestyle and active lifestyle in our communities. By doing so, dipetlele tsa rena di tlo fokotsega, ga ke re di tletse. But by doing so, dipetlele tsa rena di tlo fokotsega. In the spirit of Bathopele principles, we reaffirm our commitment to leaving no one behind. Progress is possible when we unite. Today we honor lives lost, we celebrate strides made, and we renew our pledge to end TB in our lifetime. A healthy family is a thriving community and a productive South Africa. The philosophy to advocate zero harm starts with me, and it also starts with you. Let's take personal accountability in this fight. Let's eliminate stigma. Stigma bagaetsho. A re ska kgethollang batho ba nang le TB le ba ba nang le HIV and AIDS. And let's attain freedom from all forms of TB. Together, we turn hope into action. In closing, Honorable MEC Lehar and Premier, I will not be doing justice if I don't talk about the ex-mine workers project. The project elong gore I worked mo go yona before before I went to the National Assembly. The project, which is very close to my heart. As part of vulnerable groups, use the momentum of World TB Day to advocate for better occupational health services and continue with compensation systems for ex-mine workers, including tackling the social determinants of health. Honorable Premier, we really appreciate this opportunity to be part of this August event. On Monday, we will be in KZN attending the National World TB Day. So together we can fight this TB. Together we can end TB. And yes, we can end TB. Thank you very much, Program Director.
Ra leboga bagaetsho le utlwile ke re a re Harmony a etsa phoso ga ile fa di programa tsa bone tsa TB di tja fatshe bagaetsho ka ntle ga go senya nako ke kopa se fela se ne ke bua ka sone se le gore community e gone go tsikinyega khale ba dutse fatshe my selector fela nyana se le tla community tsikinyega
tswela pele le tlhanyana o tla phumulana
Jesus the Savior, we have Jesus the Provider, Jesus the Healer. Jesus Christ, the Healer. Jesus Christ, the Savior. Jesus Christ, Provider. Jesus Christ, the Healer.
Okay. Re le fa fela taste. So. Ntwe monate a re ile sebaka ne re. Ra e busa. Northwest Province has successfully treated 83% of TB patients. We are left with 17% to make 100. Doctor, 83%. In South Africa, we have 1.1 million people living with HIV, and Provincial AIDS Council is here to help us. Marane stele murudu na. O le ejiwa Department of Teletimi haimo. Erewa wone ntate mongale from health. Erewa wone ntate mongale. You are leading a team of health. Almufe mato. Now, erika tsitsibala ba heso. Re tlo tsa sebaka se re kopa moprimiri a tlo bua le rona. Ke ena a yang ho direla ntho e re bitsang keynote address. Ke ena sebui sa letsatsi. Ha fetsa ho bua, then give vote of thanks, then Raja, then Razama. Halala rona halala. Now, Baba is in premier, just in brief. Utago Dr. RSM region. Baba Mizi. Kimuruta wana ka dipampiri. Doctor. Kimuruta wana ka dipampiri. Hafela mo is a former school principal. Hafela mo nele director ya public works go Dr. RSM. Hafela mo is a former chairperson of Dr. RSM region. Hafela mo Heribuaso ki deputy chairperson ya ANC mo province ya Bokoni Bophirima. Ntumelle nkibitse mo primiri abuelele na matsogo le melle. Premier, over to you.
Rakatula mo fatshe ba gaetso. Halala Tshing halala. Heita Tshing heita. Thank you very much. Program Director, family members of the activist Sandra Modise, members of the Northwest Provincial Council on AIDS, comprising of civil society, government and private sector, members of the Executive Council present here today, Deputy Speaker of the Northwest Provincial Legislature and Chairperson of TV Caucus, honorable members of the Northwest Provincial Legislature present here today, Honorable Marcel Losenne from the National Assembly Portfolio of Health and Minerals and Petroleum Resources, also a member of the South African TB Caucus, executive mayors, speakers, chief whips, MMCs, councillors present here today, heads of departments, senior government officials, chief executives of the state-owned entities and private sector, leaders of faith-based organizations, the Northwest House of Traditional and Khoisan leaders under the stewardship of Khosi Mautwe, distinguished guests, business, mines, companies which are here, we all thank you and say Dumelang Bagaetso. Let me first start by acknowledging and thank private sector that contributed to the success
of this event. We have our sponsors who are amongst our midst, African Bank, Metropolitan, Old Mutual, Oriam Institute, Sibanye Stillwater Mine, Harmony Mine, Mahalis Water. Private sector also outside Bahai, so it is the medical aid schemes, Renale Bonitas, Renale Tebe medical scheme, Renale Sisonke, Renale Discovery. Those are the medical aid schemes that we have outside. Baupele Matsogo Bahai. Kontang Khabone, this event will not be a success. Program Director, today as a province, we also join and commemorate the World TB Day. And this is to reaffirm our commitment in reducing the incidence of tuberculosis and our fight against HIV and AIDS in our communities. We have gathered here also to reiterate the policy position of our government in ensuring full access to health care by our people in pursuance of a TB-free province. Critically, to live up to the promise we made more than 30 years ago of guaranteeing our people access to health care and enshrined in our Constitution. But this access to health is not only access, but also quality access to health. So it's also quality. Now, many years of racial exclusions which denied our people free primary health care and better health facilities continue to dictate the socio-economic trajectory of our country, and in particular, our province. We are therefore called and compelled to redouble our efforts to reverse these injustices through various measures and resources at our disposal. The newly built Ventersdorp Bulk Pharmacy and Buikutso Park Home Clinic, which we handed over to the community last year, affirms our ongoing efforts to build healthcare facilities closer to our people where they reside. The commemoration of the Human Rights Month, held under the theme, Deepening a Culture of Social Justice and Human Rights, must serve as a reminder to all of us about the importance of building communities where our people will enjoy their rights with provision of health care as one of our apex priorities. Program Director, today we are gathered here as a province, united in our commitment to a cause that affects millions across the world, the fight against tuberculosis. This is a day which marks Dr. Robert Koch's groundbreaking announcement of the discovery of the bacterium responsible for TB in 1882. However, more than a century later, TB still remains a global healthcare concern. Our country, South Africa, forms part of 30 countries in the world, accounting to 87% of the global burden of this epidemic. And it's counted among the 10 countries with the triple burden of TB, HIV co-infection, and drug-resistant TB. Compounding this situation is the Bojanala and Dr. KK Kaunda districts, which continue to have a high TB burden compared to other districts. This is largely attributed to mining activities in these two regions, Bojanala and Dr. KK, because it's fueled by the predisposure to silocosis as well as spatial planning challenges due to the mushrooming of informal settlements. Bagaitsu, our decision to host this event in this district is primarily informed by the aforementioned factors, but equally galvanized support from business and civil society organizations to respond to this health scare. This year, commemoration, it's centered on community-driven efforts to find a missing TB cases, educate communities, and strengthen TB prevention and treatment programs. Held under the theme, yes, you and I can end TB, and commit on investing and deliver. We are putting an emphasis on the importance of a sustained commitment, financial investment, and the effective delivery of interventions critical to prevention, diagnosis, treatment, and care. While tuberculosis remains one of the leading causes of death from infectious disease worldwide, it is both preventable and curable. Therefore, TB ya alafesega bagaetso ene re ka ikganela mme ha re tlogela e ka dira gore matlhoko a leng opportunistic a re bolae mme go itlhela gone yaanong TB remains one of them. Our country, South Africa, bears the highest burden of TB in the world, and this disease continues to devastate our communities, especially the most vulnerable, and in this case, the poor, those living with HIV, and communities with limited access to quality health care. That is why, as a caring government, we insisted on ensuring that HI comes in, so that this insurance must be able to help even those who are unable to afford medical costs. Despite this setback, we have made significant strides towards tackling this epidemic. What we have done, we have expanded TB screening services, increased access to treatment, and integrated TB care into our broader healthcare system. And therefore, that's how we have expanded access by ensuring that the TB screening is accessible closer to our communities throughout the province. In the third quarter of the financial year under review, our province reported 70% of people in contact with TB and who have started TB preventative therapy. And therefore, this is a success rate, to be above 70%, to ensure that people who were in contact were tested and they have started treatment. Over 26,000 TB tests we conducted in the province, with over 2,700 cases diagnosed in the same period. So our nurses, our field workers are out there in our communities to ensure that we test, especially those who were exposed to this disease. Therefore, we are able even to now put people on treatment who have been positively diagnosed. This culminated in the drug-sensitive TB treatment success rate of 82.2%, as well as drug-resistant TB treatment success rate of 85%. Therefore, we are doing very well amongst the provinces in the country. Furthermore, all drug-prone tuberculosis deaths have declined from 10% in 2020 to 7% in 2022. Therefore, maso a otle a diragalang as a result ya gore batho ba ne ba tshwere ke TB ka 2020 re ne re na le 10% batho ba swa ka gore ba tshwere ke TB le malwetse a related. Jaaka re bua go ka the last results in 2022, we are only sitting at 7%. That signifies the manner in which we are responding as the Northwest government through our department, and therefore we have successfully reduced the death rate. This trajectory defines our intervention measures in TB management and control in our 4 districts of our province. As a province, we will continue to build on our historical success and the lessons learned from the past. You'll recall, those who follow health issues, we were the first province in the country to cure an extreme drug-resistant patient at our Center of Excellence in the Klerksdorp Tshepong XDR-TB unit. And that was a history that we made as a province to be able to be the first to treat a very extreme drug-resistant patient. Following the success and getting more patients cured at Klerksdorp, Tshepong, we will later decentralize to Taung, where many patients have since been cured and continue to receive treatment. Therefore, our success in Klerksdorp is now expanded up to levels of rural areas like Taung, where we treat our patients, and that shows that we are expanding. However, the reality is that many still suffer in silence, undiagnosed, untreated. We still have a lot of our people who are afraid to disclose gore ba tshwere ke TB and other related disease. Probably it's because of the stigma, but it's important that people must come clean. Our responsibility as government is to reach out to every individual and families affected by TB and ensure that no one is left behind. Government has developed a national policy for TB prevention, which focuses on multi-pronged approach, including infection, control, early diagnosis and treatment, including interventions for people living with HIV and AIDS. This policy is primarily aimed at reducing TB transmissions and achieve a TB-free South Africa by 2032. As the world is confronted with this scourge of TB, political commitment is essential to develop and maintain a successful response to this epidemic. It is important to note that TB remains very much a poverty-related infection and mainly affects persons in vulnerable situations with insufficient access to diagnosis, treatment, and healthcare services. Program Director, as such, we need to strengthen multi-sectoral collaboration to halt the negative impact of TB epidemic and invest in the health and well-being of our communities and deal with the issue of food security. This commemoration is a call to action for all of us to come together, join hands, and raise awareness, promote access, advocate for research, and strengthen partnerships. As a collective, leaders and communities alike, we need to remind ourselves that ending TB is not the responsibility of government alone. It requires a collective effort. That means that partnership between government, civil society, the private sector, last but not least, our own communities. To our health care workers, your dedication is commendable. Your stand on the front lines, ensuring that those diagnosed with TB receive the necessary care and support. We thank you for your tireless efforts and your unwavering commitment to saving lives. To our communities, we urge you to support one another, encourage early testing and adherence to treatment. It's useless to test and be diagnosed, but you don't attend your treatment. But also break the silence around TB so that together we can break the chains of this disease. Let us commit ourselves to action and strengthen our health system. We must strengthen our health systems. We must also invest in research and embrace innovative solutions that will accelerate progress and save lives. Let us work together to eliminate TB from our province, our nation, and the world. Together, we can end TB. Together, we can build healthier, more resilient communities. I thank you. No, ke tle go ntsha certificate tse tharo in recognition of the outstanding contributions to the fight against TB in the Northwest. Re tla bitsa baemedi ba Northwest PCA Men's Sector. Ba tle go tsaya this certificate of appreciation. Northwest PCA Men's Sector. Tampagama stage. Opa matsogo bagaetsi. Ya ke ditshwele. Okay, ditshwarele. Are tse batseng. Eke Northwest PCA Men's Sector. Arba pele matsogo bagaetsi. Okay. Right. Re tlo go bitsa Northwest people living with HIV sector. Baemedi ba bone ba pagame serala re ba leboge gore re lebogela ebile re iponela tshegetso mo go bone jaaka batho ba ba tshelang ka botlhoko jo le contribution ya bone. Hope. Eh, monna rona Hope, ke mosimane wa ko Taung. A re ba opeleng matsogo bagaetsho. Thank you very much. Oh, ba setse ba tlong bagaetsho. Re le tse snap. Eh. And it's mine. Oh, MECR has had this snapper. Chica Shebele. Smile. Thank you. Okay. Re tlo go biletsa ka kwano baemedi ba Northwest PCA faith-based sector. Oh. Wa emela baruti. Oh. Re naya modulasetulo a re ke ena a emetseng baruti ha le ha baruti ba teng. Mo pele matsogo bagaetsho. Ke moruti Neo Moepi. Ba ba sa mo itse. Ra leboga. Thank oh. Monna rona wa snap ga se a etsa. Thank you very much Motsamisi. Okay.
Bagaetsho o primary wa hijack gape.
Ke moemedi wa African Bank ya bagaetsho ke ena ntshitseng dimpho tse mo pele matsogo bagaetsho. Thank you very much. Ra leboga.
La gaetsho la e bona private sector gore e irang akere. E thuntsa le role. La bona African Bank e busy mona. Bagaetsho le wa utlile mo foka mo primary o ne a gatisa thata mo le gore to close the gap ya 1.1 million e mo community e mo malapeng. Ka ntle ga go senya nako before ke tlo bitsa councilor Matsapola go dira vote of thanks mare pele ga atla mo moraga gage ke tlo kopa a councilor Matsapola a sena go bua o tlhophilweng go tlo dira di announcement gore ka gore ke 1 o'clock gore re ja go kae a ba ikatumetse immediately fela after mama Tsapola o tlhophileng for the announcement a ba ikatumetsa a re beletse mo primary matsogo la bofelo ba gaetsho. Councilor Matsapola, over to you.
Thank you very much, Program Director, the Honorable Premier, the MECs, led by the MEC of the department, Ndate Lehare, my colleagues, led by the acting mayor of JB Max. When we got a brief about this event on Monday at constituency office by the team here, PCA, led by Ndate Neo Moepi, I had to go to my archives and found a poem written by Christina Rossetti just to find solace in commemoration of this day. It's not a very long poem, Miss Me But Let Me Go. The poem goes to Sandra Modise and the rest of the soul that departed because of TB and HIV and AIDS. When I come to the end of the road and the sun has set for me, I want no rides in a gloom-filled room. Why cry for a soul set free? Miss me a little, but not for long, and not with your head bowed low. Remember the love that we once shared. Miss me, but let me go. For this is a journey we all must take, and each must go alone. It's all part of the master plan, a step on the road to go home. When you are lonely and sick at heart, go to the friends we know, laugh at all the things we used to do, miss me, but let me go. My task today was just to make a vote of thanks, the community at large, because it's a provincial event. Baagi ba Tshing, le metse e mabapi, metse setoropo ya Bokone Bophirima, all the departments that are here. We are happy that the department itself of health managed to gather such a program for remembering those who are departed. In those few words, thank you very much. Ke lebogile bagaetsho.
Okay, se sa feleng sa tlhola. O ka lebelela kwa hao. Around 1 o'clock, re tshwere nako. Because rena, the program director, ne re sa fafatla, ne re tsamaisa program, ne re sa video speech rena. Vote of thanks. Eta mama, ka kera dijo. Announcer mama.
Thank you, MEC.